Hello, my name is Dr. Sean McCorkle. I'm at Summer Creek Animal Clinic, and today I wanted to address some of the common myths about dog nutrition. And my assistant Lauren's going to help by asking some questions. So we hope this is helpful for you to navigate some of the common myths in dog nutrition.
Hey, Dr. McCorkle, is a dog able to live a vegan diet on a vegan diet?
Yeah, that's a good question. That's becoming more and more commonly asked. And so the thing to understand about dogs is they are what's called omnivores, meaning that they can live on both a meat and vegetarian diet, similar to people. Whereas this is a very important distinction when we're talking about cats. They are obligate carnivores, meaning that they must eat meat. They must have a meat-based diet because their protein requirements are so high. And so the answer is yes, you could feed your dog a vegan diet, whereas the answer would be a very hard no for cats. And so to break that down a little bit more for dogs, even though I say yes, they can, I would say it would be particularly challenging. And what I would suggest, if anybody is interested in doing that and it can be done, would be to work with a veterinary nutritionist that can help formulate homemade vegan diets that meet all of the nutritional requirements. That's the big thing. I think anytime we are either doing any sort of home cooked feeding or particularly something really specific like a vegan diet, there's a lot of opportunities for missed nutrition that can in the long run harm your pet. So if you want to do that, please make sure you work with a ideally board certified veterinary nutritionist.
Sounds good. Is wet food more nutritious than dry food?
Yeah, no, it's not. The big difference is that wet food has a huge amount of water content. So usually anywhere from about 75 to 80% of the food in the can is water, which certainly has its benefits in some circumstances. So if you've got a dog, I have one myself that is just not a big drinker and can kind of lean on the dehydrated side if we aren't careful. Adding some wet food to the diet can be really helpful because it adds water content. Also, in certain chronic conditions, for example, kidney disease, having added water content can be really helpful for dogs that aren't able to maintain hydration status as well because of underlying disease. So it's not really, you can obtain adequate nutrition with both dry or canned food or a combination of the two.
What about a prescription diet? Is that better for my dog?
Yeah, I think the prescription diets are oftentimes extremely useful in a lot of different circumstances because prescription diets actually treat or manage specific conditions. So if your dog has underlying joint disease, you can use prescription joint diets to help manage that. If your dog has urinary problems or a history of bladder stones, which are actually fairly common in dogs, there are prescription urinary diets that will help reduce the risk of recurrence once the underlying issue is addressed. And those are just two of many examples where prescription nutrition can be very valuable. But that because they are prescription diets, they have a particular thing that they're treating. They have to be prescribed through a veterinarian to ensure that it is the appropriate diet for that pet. But my personal opinion and the way I practice is I do rely heavily on therapeutic diets whenever possible, because if we can manage or treat disease through nutrition, I think that's always a good starting point.
And if my dog is eating grass, does that mean that they're missing something from their diet?
No, not typically. I've never seen that be the case. When dogs are eating grass, sometimes they're just dogs, and I have a dog that will occasionally eat grass and never throws up, and she's kind of like a horse in that sense, I guess. And that's kind of I think the uncommon scenario. I think most commonly what I see in practice is dogs that are eating grass and they either haven't eaten their dog food that day, and so they're a little nauseous. So they eat grass and then they throw up afterwards, or they throw up and then they go eat grass. So there's usually a connection with some sort of underlying nausea or some sort of GI upset. And the underlying cause of that can be so many different things, but it's typically related to that versus they're not getting adequate nutrition. And so they're trying to find something in grass or something else. That's typically not the case.
Okay. And will human food make my dog overweight?
Yeah, that's a good question. We see this type of thing a lot, and inherently, not necessarily. I mean, you can feed your dog very small amounts of human food and still be a lean dog. The problem is once you start feeding them human food, they become more acclimated to it. They end up hanging around you a lot more when you're eating. They end up begging more. You end up giving them more food. In most circumstances, dogs do tend to be overweight when they're fed human food regularly. The other thing that's really important is when you're feeding your dog human food, if they're eating that in addition to their normal dog food, especially in smaller dogs, but really in any dog, you have to understand that the density of those calories is so much more impactful because the animal that you're giving it to is smaller than what our normal context is, which is us. And so even a small piece of meat in a 10-pound dog is like an entire meal for somebody our size. So that on top of their dog food tends to set them up for a situation where they will tend to be overweight. Now, the other part of that is if they are eating more than 10% of their daily caloric intake from things that are not their balanced dog nutrition, then you run the risk of having a nutrient imbalance. And typically when people are feeding human food, I see this over and over and over again, dogs will tend to lean more heavily on that human food and start to eat their dog food less and less. In many cases to the point where they're not even eating their dog food anymore, or very sporadically, because they're getting their nutrients and their food on the human side. And that is setting them up for nutrient imbalances, unless you're just really, really diligent about it. The other thing that I wanted to mention with the human food is not only about their weight, but there's a much higher risk of having significant GI related issues, particularly pancreatitis in dogs, and a condition called HGE, which can sometimes be related to certain food indiscretions. And so, feeding dogs particularly high fat meals, even small amounts, I've seen that trigger those type of conditions, which are potentially very dangerous and certainly very costly to deal with.
Thanks for that. Will free choice feeding make my dog overweight?
It has the tendency, just kind of like the human food situation, to lean in that direction. And so you can do free feeding in a single dog household successfully and have a lean dog. And sometimes even in multi-dog households, but it's a lot more difficult to manage the more dogs you have. Because if you think about it, if they're free feeding, you have no idea who's eating what, how much they're eating throughout the day. So there's no way to tightly control their calories. And so I definitely am a big proponent of meal feeding, typically twice a day, because that's most practical and it keeps the metabolism going consistently throughout the day. And that allows you to control exactly how much each pet is eating. So you're using a measuring cup, working with your veterinarian to figure out how much to feed. And the goal there is to feed towards an optimal body condition.
Okay, and last question. Are there any other myths about dog nutrition that you hear as a veterinarian?
Yes, we could probably talk a lot about this. I'll try to pick some of the highlights, but I do think there's some other things that should be touched on because it's super common. And I would say probably the biggest thing nowadays is the grain-free movement, and that has gained a ton of traction in the last several years. It's been slowed a little bit, I think, with the concerns with heart disease linked to that, but it's still a big thing. And so it's not that grain-free is necessarily inherently bad. Although some of the deficiencies that they've identified that can potentially be linked to underlying heart conditions in some dogs is a little bit of a concern there, or certainly a concern. But I think the bigger picture of people thinking that grain-free diets are inherently better for their pet, that's the part that does not have any sort of research behind it to support that. It's more based on assumptions about how dog nutrition works. And so the problem that I see with that is that, again, there's no research to support it. And one of the biggest things that I see clinically is dogs that are on grain-free diets tend to be on the more overweight side of things. And I think that is largely to do with what has to be done when you move to a grain-free diet. So for example, one of the big concerns is corn. A lot of people, if you start talking about corn and dog nutrition, can become very heated because people say that corn is a filler, and a lot of companies use it just to fill the food, and it doesn't really have any benefit. And if anything, it's harmful to the pets. And so that's, one of the grains that gets removed. The problem is corn, when it's properly processed, is very dense nutrition. That's why pet food companies use it, because it provides a lot of nutrients for the pet. And so when a company removes that because they're wanting to make a grain-free diet, they have to replace it with something else. Otherwise, they'll have a nutrient deficient food. And so as an example, oftentimes what they'll replace it with is something that's like a more starchy carbohydrate like potatoes, in order to label it as a grain-free diet. I think as a result of that, it tends to be a more carbohydrate dense diet. And dogs, generally speaking, this is not across the board, but they tend to be more prone to gaining weight. So I see that as one of the problems, certainly the concerns with the links to heart disease. And then really just the struggle is that many people are moving their pets to grain-free diets because they have an underlying issue, whether that be skin allergies or GI issues. And they think that the grain-free diet is going to fix the problem, which most of the time it doesn't, because grain is not a common allergen in dogs. There's not good research to say, yes, this is a common allergy, therefore we should move in this other direction. And so I think it's giving a lot of pet owners false hope. If I have a pet owner that has their dog on a grain-free diet and the dog's doing much better than it was before, I'm certainly not going to argue that. And I've definitely had that happen on a few occasions. Now, the other big thing I do want to hit on, because I see this actually as probably this is just my experience, the biggest thing that I'm seeing more of, maybe even more so than the grain-free nowadays, is high protein diets. High protein diets in dogs are extremely common, and it's kind of just become the norm that is what is good for the dog. The problem is, again, the research does not support that. And I see clinically a lot of problems from dogs that are on high protein diets, especially older dogs. The older your pet is, the harder it is for them to be to process that protein. So in a good, well-balanced diet in an adult dog, a diet that's really cognizant of the nutrition that's being provided and is creating their diets based on the current research that's out there, you're going to see proteins usually in the low to mid 20s as far as a percentage. And that's on a dry matter basis. So that'll be the percentages if you're looking at a dry food. These other diets that I'm talking about, and there is many of them, it's actually probably more of the norm now. They're upwards of 30, and I've seen some even as high as 40% protein. The liver has to process that extra protein, and the kidneys have to excrete the breakdown products. So we will oftentimes see dogs with abnormalities in their blood work because they're getting all of this excess protein that they don't need, that their body is having to deal with. And the older your pet is, the more harmful that can be. So the myth would be that high protein diets are inherently good for dogs. And that is just, unfortunately, not true. It's not based on research. And the older your dog gets, the less protein they need. So senior diets, the good ones, are typically going to have even lower protein, closer to 20%. And then dogs with kidney disease, even lower percentage, even potentially down to 15 or 16% protein if there's significant kidney problems. So I could go on with additional ones, but I think those are the two hopefully most impactful ones for where we're at right now with pet nutrition. If you have any other questions, we'd be happy to help you sift through these things. You can reach us at 817-523-1139 at Summer Creek Animal Clinic. And our web address, which has a lot more information on pet nutrition and other things, is summercreekvet.com. Thank you so much.